Hello, my name is Dr. Ogechi Sylvia Eze, also known as the SopranoDoctor. And today I'm going to talk about glaucoma. This week in the month of March is known as Glaucoma Awareness Week. So with a passion for preventive healthcare as well as educating and empowering the populace, I wish to talk about glaucoma, which is also known as the silent thief of sight. So I'm going to be running through the definition of glaucoma, talking about the symptoms that patients might present with. This is important because then you know when to go see your doctor, the treatments that patients will be presented with, and then what are the risk factors. So I'll be getting my information from the NHS websites if you want to read more and know more about it. So glaucoma is a very common condition of the eye, and it's caused by damage to the optic nerve. So the optic nerve is the nerve that innervates the eye or receives stimuli or signal from the eye and then goes to the brain and interprets it as images for us. So it's usually caused by increased pressure in the eye. So the eyeball is full of fluid, and then it has the front chamber and the back chamber. So whenever you have increased buildup of fluid in the front of the eye, the pressure. So imagine that this is the eyeball. This is my Weave-On brush, don't mind me. This is the eyeball, and this is the optic nerve at the back. So imagine this gets tense, filled up. It puts pressure on the optic nerve and can damage the optic nerve. And if it is not detected early, it can cause loss of vision. And that's why it's important for us to know about it. It affects people of all ages, but more in adults in their 70s and in their 80s. So what are the common symptoms of glaucoma? Sometimes it doesn't cause any symptoms, but then if it develops slowly, what you notice is what we call tunnel vision. So it's like you're walking through a tunnel. You cannot see things beyond this border. So loss of peripheral vision. Sometimes when people look at lights, they notice that there are halos or like rainbows around lights. Most times both eyes are affected. Sometimes it could be worse in one. And then, so we've talked about the slow progression of glaucoma because there are two types, and I'll talk about that later. Then you now have the acute type of glaucoma, and this is when it comes on suddenly. And those are the ones that are real emergencies. Patients might come down with sudden severe eye pain. The eye might just go red and you'll be able to see the blood vessels. Sometimes patients will start vomiting or feeling sick. There might also be headache. And sometimes they can also mention having pain or tenderness around the eye. The vision might become blurred or hazy. And then, like I said before, looking at lights, they see halos around lights. Those are red flags. When do you need to seek urgent medical advice? When do you need to see your doctor or go to an emergency department? When it comes on with sudden eye pain, vomiting, feeling sick, halos around light, blurring, those are the red flag symptoms, and those are emergency situations whereby you need to seek emergency medical care. Yeah. So the types of glaucoma. So there are several different types of glaucoma, but then the most common type of glaucoma is what we call the primary open angle glaucoma, and that's the one that gradually builds up. So if you remember, I talked about fluid building up in the front of the eye. The eye has, inside the eye, if I use lay terms, they're like gutters that drain fluid from the eye. So if this gutters should close up, then you have that fluid building up. So in primary angle glaucoma, the angle of the eye is still open, but fluid still builds up. So you then have, so we've talked about primary open angle, and then you have acute angle closure glaucoma, and that's the one that's caused by the drainage suddenly getting blocked, and then you have a sudden rise of pressure in the eye, causing that pain, that feeling sick, that nausea feeling. Then you also have so we've talked about primary open angle, secondary open secondary so primary angle closure, acute angle closure, and then you have secondary glaucoma, and this is caused due to inflammation. And in this situation, you have the drainage of the eye getting blocked due to inflammation, swelling. Then you also have you could also have childhood glaucoma, and this is congenital. In this situation, the child is born with it. It could be due to several reasons. I still need to do some more research into it. So we've talked about the types. Now, what are the causes of glaucoma? So like I said, it's usually due to buildup of fluid if the drainage of the eye gets closed. The literature says that it's really unclear why this happens, although certain things can increase our risk. Age, the older we get, like I said in the beginning, usually more common in people in their 70s and above, the older we get. 2, ethnicity. So those of us from the African or Caribbean ancestry, we seem to be at higher risk of having glaucoma. Number 3, family history. So that's why it's good for us to know family history. If somebody in the family has got it, then we need to know and be aware, and be aware of the symptoms in our eyes, and know when to seek medical review. And then other conditions like diabetes. See why we need to ensure that if there's a history of diabetes, we're taking our medications and controlling our blood sugar. And then also people who have got other eye conditions, short-sightedness, long-sightedness. And then, is there really anything we can do to prevent it? I'm not too sure, but I think, if we've got any history of refractive disorders, short-sightedness, long-sightedness, make sure we're going for regular eye checkups, healthy diet, feed well, try not to put excessive strain on our eyes, and then, tests for glaucoma. So usually glaucoma is detected on routine testing. So those are the things we can do, routine testing. So from the NHS website, we are advised to ensure we see an optician at least every 2 years. Yeah, that's for those who haven't got any eye conditions, at least every 2 years. And then if the tests, what they do is they use an instrument called a tonometer to check the pressure in the eye. And should this pressure be raised, you'll be referred to a specialist who will then follow it up from there. And then the treatments for glaucoma, it could be with eye drops to try and reduce the pressure in the eye. There could also be laser surgery. And then there could be full-blown ophthalmic surgeries. Further information will be given when you see your ophthalmologists, when you see the ophthalmologist. So if you need to know more about glaucoma, I would say speak to your family physician first of all. You can speak to your local optician, and you can speak to your ophthalmologist. And then there's so much information, peer-reviewed information on the NHS website or your local hospital website. Attend lectures, medical lectures, and then you can get some more information. And I hope I've been able to share some information. If you have any questions, please put them in the description box down below, and then we'll take it from there. You can get some good information on the Royal National Institute for the Blind, and then there's also the International Glaucoma Association. I hope I've been able to do a little bit of teaching here. Thank you very much. It's me, the Soprano Doctor.